Hi, everyone. My name is Nabeela Syed. I am the state representative of the 51st House District. I was elected back in 2022, recently reelected in 2024, and serving out my second term. I represent communities that overlap with the suburbs of Palatine, Inverness, Hoffman Estates, Killdeer Deer Park, a little bit of Rolling Meadows up until Hawthorne Woods and Lake Zurich. So my district is half Cook County and half Lake County. This district has a 14% Asian American population, a 74% white population. It's the community that I was born and raised in. When my parents immigrated from India, from Hyderabad, they settled down here. I was born and raised in Palatine, and I'm very, very proud to represent this community. In 2025, some of my top policy priorities were around healthcare, and whether it was reducing barriers to mental health care access, eliminating prior authorization for outpatient behavioral health care services, or continuing my work on establishing a prescription drug affordability board here in Illinois. The conversations I have with people when I go door to door are that the cost of everything is just too high. And one cost that I think people cannot afford to compromise on is costs related to their well-being and to their health. And unfortunately, we have people in our communities all across the state that are making difficult decisions about rationing their medication or avoiding a trip to the doctor's office to seek preventative health care. And that's causing dire impacts on their lives. So I believe as a legislator, it's imperative that we continue to shine a light on the inadequacies in the healthcare space and what we can do at the state level within this larger healthcare system to help address some of these barriers and reduce them for our residents. I would say I think the state budget is probably the biggest thing that continues to have the largest impact, and I think people don't often talk enough about the numbers, the number of social services, the funding that goes into different organizations that impacts people within our community. So when I'm thinking of senior related initiatives, we fund a lot of senior services through the state of Illinois, through Age Options, through Age Guide, through our agencies that funnel money there that are doing a phenomenal job of making sure that there are social programs available for seniors that are living home that might need access to meals. We have a great Meals on Wheels program that different organizations run. So I would say continually the biggest thing that ends up supporting our residents at the highest level is our state budget and making sure that funding is reaching the most vulnerable in our communities and is helping alleviate and address some necessary issues. We're really building a strong case for the prescription drug affordability board that I mentioned, and especially given just the uncertainties that are coming down from the federal level related to SNAP, related to Medicaid. It's important that we're doing what we can at the state level to help smooth out the pavement for people in our communities, and that's a nicer way of saying that we really have to pull on every single lever that is possible to lower costs for our residents. I was just talking to a couple and they run a business. They're entrepreneurs, and they have to rely on healthcare through the marketplace in order to seek out preventative care, in order to go to their primary care doctor. And they're concerned about changes to their subsidies. And that is an affordability issue that there are issues that are occurring that will exacerbate the economic outcomes and outlooks for people in this upcoming year. So at the state level, I do think it's imperative that we do whatever we can in policy to help alleviate some of those things coming down and help our residents cope with those changes without having to compromise on their care, and whether or not they go to the pharmacy to pick up their medication or whether or not they, are able to pay their utility bill. So I think those will inevitably end up being the focus of 2026. And I think it's important that we keep those things as the focus, because if people cannot afford to stay in our communities and they can't afford basic needs, that to me is where government is failing. I think it is so important for constituents. Well, I would say first and foremost, on a personal level, if people could open their doors when I'm knocking on them, that would be great. I think some of the best conversations and the best bill ideas I get are from people that are willing to lend their time at the doors. And I say that a little jokingly earlier about people opening their doors, but I cannot tell you how grateful I am for the opportunities where people give me, 2 to 10 minutes of their day and are willing to explain an issue that's going on in their personal life for me to be able to take that information and do something about it, or at least try to do something about it, or at least have that knowledge when I'm voting on bills and knowing that this person in my community is affected by this issue. But continuing to stay engaged, I think many legislators have district-wide events that we encourage people to come to so that we can get more interface with the community, understand what the community cares about. I try to fill up my schedule with community events as well, where it might be helpful for me to better understand an issue. I just came from one earlier today. So continuing to, the biggest thing is viewing us as partners in the community and reaching out, even if you don't know if we could help, we could try to connect you with someone who could help. We want to be a community resource here as well.